So I'm here to introduce Graham Gulbransen. He's been part-time general practice from at least 83, and much of that work involved in assessment and management of addictions and chronic pain. Graham's an addiction specialist. They're managing problems, alcohol, drug withdrawal, opioid substitution treatment, medication for chronic pain, does addiction assessments. So since at least 2018, Graham's been involved with the medical cannabis service, and he opened the first medical cannabis service in New Zealand, Cannabis Care, up in Henderson. Provides specialist consultations for legal medicinal cannabis prescriptions, problems addressing chronic pain, cancer symptoms, anxiety, chronic insomnia, and neurological conditions. And he's going to tell us all how to vote in the referendum, aren't you, Graham? So over to you, Graham, about medicinal cannabis in 2020.
Tēnā koutou katoa. Yes, I'm Graham Gulbransen, talking to you from my office in Henderson, and I'd like to just give you a little overview on prescription cannabis, and we'll leave some time for questions. So let's go. Cannabis is like a lot of other plants. There's a whole range of different cannabis plants. Think of it like tomatoes, where you've got small sweet ones to big large red ones, and every colour in between. And cannabis plants are a bit like that, and some have a lot of THC, some have a lot of CBD, and some are balanced or in between. And for those who want the euphoriant or the intoxicant effects, they'll be looking for THC dominant. And for medicinal use, we're more likely to prescribe a mix of THC and CBD or CBD. There are plants that produce the different balanced different ratios. And so, for instance, this company called Bedrocan in the Netherlands has their flagship variety, which is 22% THC. And so they grow clones of these. Their Bediol is their balanced with equal THC and CBD. And then Bedro Light down at the CBD end has got very little THC. So plants can be grown to produce the kinds of cannabinoids that people are wanting for their particular properties. Now, when patients or people go to buy illicit cannabis, it's likely to be abundant in THC. You can see the average is around 15%, but there's a huge range. And CBD is close to zero, and that's because prohibition has caused the production of very high concentrations of THC, but also when people buy on the black market, they don't know what's in it exactly, and it could be a whole range of different levels of THC. The spectrum of use, well, if we start at the right side, adult use, this is the term for recreational use. And in between, I've got therapeutic, which is where people are using cannabis either grown themselves or from the black market, illicit cannabis, and they're using that for therapeutic purposes. And what I'm prescribing is medicinal or prescription cannabis. It's all the same plant, it's just different properties make it suitable for different purposes. Here's just a quick explanation of the difference between CBD and THC. So tetrahydrocannabinol, let's go to my highlighting. This is the euphoriant, and too much of that may lead to impairment, such as with driving or relating to other people. People get stoned or high. But if you balance it with CBD, you won't get such impairment. And let's look now at CBD. So the properties of CBD, when I prescribe it, it could be for pain relief, muscle relaxation, for relieving anxiety. It may have antipsychotic benefits, and so on. Whereas CBD has similar effects and can actually be stronger. So while you get high from THC, it does have therapeutic benefits, as in with pain relief, reducing nausea and vomiting. It can have anticonvulsant effects and so on. But if we combine them, it's called the entourage effect. And so the combination of different components of cannabis work so much better in a synergy. And the CBD may reduce any adverse dysphoria or euphoria from the THC. In the last 2 or 3 years, I've prescribed cannabis to about 1,500 patients. And around the world, the typical patient is a pain patient. So half of my patients have turned up with chronic pain, usually intractable pain, not responding to standard treatments. And then I've divided my other patients into cancer, which can be cancer symptoms or the adverse effects of cancer treatment. And you'll know that chemotherapy, for instance, can be associated with nausea, vomiting, poor appetite, weight loss, and cannabis may have a role there. Emotional, this is treating mental illness with cannabis, and anxiety often responds really well. And then my neurological group, this would be seizures and spasms and peripheral neuropathy. And you'll know that most of these are not responding to standard treatments, or I'm seeing patients where standard treatments haven't worked that well. I'd just like to give you an example. So my pain patients, I went through around 500, and fibromyalgia responds really well to CBD. But osteoarthritis, PMR, low back pain, neuropathic pain, central sensitization, that long-term pain that doesn't seem to respond to anything, where there are deeply ingrained aberrant pathways that are easily triggered, endo, trigeminal neuralgia, etc. Migraines, I've had some good results with people using prescription cannabis to prevent migraines. The emotional distress group, mainly anxiety, depression, but insomnia. And if you've got anxiety, you may not sleep that well. However, ADHD seems to be calmed with CBD, and people report better focus. But let's just take into account that emotional distress is often a comorbidity, and we will see that with other conditions such as chronic pain, Tourette's, and Asperger's or autistic spectrum disorder, I'm seeing a whole age range of children to adults who are anxious because of their ASD, or who have inappropriate or challenging behaviour, and CBD seems to help settle many of these people. And then with the neurological group, seizures, and I'm prescribing prescription cannabis to all ages, including children, ASD, as I've mentioned, with challenging behaviour, Parkinson's and the pain that can be associated, or the anxiety, depression, chronic fatigue syndrome, where as doctors we have little to offer, but prescription cannabis can make a difference, can clear the brain fog that people often report, and these other symptoms. Multiple sclerosis, we know, often does respond to prescription cannabis. And cancer symptoms, either the pain or the loss of appetite or the emotional distress that goes with the particular cancers, or the adverse effects from treatment. I get people to come back and see me after a month. Half of them don't come back for various reasons. Maybe it's not working, or maybe prescription cannabis is too expensive and they've gone to a drug dealer for their cannabis instead, or growing their own. Then of those who do come back, you can see that about a quarter report the CBD is very good to excellent, and around 40% if I include this group. So these are often patients where standard treatments are not working and we start to see benefits. There's something called Section 29, and prescription cannabis is in this group. So these are new medicines, and this means that no person shall advertise the availability of any medicine to which this section applies, which means that the drug companies or pharmaceutical suppliers are not able to educate health professionals or pharmacists or patients because they're not allowed to advertise the availability. And it means that I need to be careful to not give you the brand names of any of these products. 3 years now we've been able to prescribe CBD products. Just on a standard prescription, any doctor may do that. So that's been a big milestone, three years now. But in April this year, the rules changed again, and that's the website that you could go to. But in summary, what we've got is that since the 1st of April, medicinal cannabis products are divided into dosage products, and this is something that as health professionals we're familiar with: tablets, capsules, oral liquids, but also dried products. Now, these are not available just yet, and we don't know when they'll be available, but we're talking about cannabis flower intended for vaporization, not intended for smoking, and not as a food. So this is separate from recreational cannabis, but it would be the same kind of material but standardized so that doctors and other health professionals will be able to prescribe dried flower products. And these are prescription only when they're used therapeutically. They're called unapproved because while they have to be of good manufacturing practice standards, so that means high quality, clinical trials have not been done. But the Ministry of Health at the moment is assessing a range of products, and we're waiting for them to allow the prescription. But a list of products is going to be made available. It's not at the moment, so we don't really know what products will be available and when. Approved products, well, there's one called Sativex, which is a spray that I'll tell you about in a moment. That's because it has been through clinical trials for multiple sclerosis, but I'm using it off-label. It is available now. All doctors may prescribe it for any condition, and so I'm using it off-label for pain, for instance, because it's got a mix of THC and CBD and is more effective than CBD by itself. We're in a transition period till the end of this month, and the Ministry of Health hasn't been able to tell us what happens after the transition. I think you don't need to concern yourself about that, but as a prescriber, I don't know what's going to be available at the end of this month. CBD, I've been prescribing it for 2.5 years now. The bottles are 25 or 30 or 40 ml bottles. They cost around about this price. That works out to be about $10 per day for patients, and the pharmacy orders them in from the wholesaler, and they're usually available for the patient the next day. Creams or balms would be very useful, but are not available at this stage. A standard prescription is written, and here's an example. Cannabidiol, 100 milligrams per ml. Take 1/4 ml in the early evening and increase as directed, 25 ml bottle. So we have to prescribe by brand, but I can't show you the brands because that would be breaking Section 29 rules. So we have to be very careful about that. But basically, CBD, standard prescription, and the dosing's fairly simple. On the right, I've got start low, go slow, standard advice for prescription cannabis. And basically, we start with a low dose in the first evening. And after a few days, when we know that there are no adverse effects, we can increase to twice daily. And then we build up. I've found that 1 ml a day, which is 100 milligrams of the CBD, 100 milligrams per ml, is often a good dose. But there are other preparations too, such as 10-10, which is 10 milligrams per ml of THC and of CBD. And I'll get to that in a minute. But it's a simple dosing sheet, start low, go slow. Sativex is the only approved item, and I've mentioned that I'm using it off-label for pain. It's approved for spasms from multiple sclerosis. It contains balanced THC and CBD, roughly equal, comes in a pack of 3 10ml bottles, costs about $900. Take a breath, it's a big shock, but basically that can last some people 3 months, and so that works out at $10 a day. And others will find that they use a much bigger dose of that. It requires a controlled drug prescription form. It comes with a package insert with the dosing, suggesting that on day 1, you start with 1 spray, same on day 2. Day 3, you start with 2 sprays at night. And then for some people, 3 sprays a day is going to be enough. You can see from the imaging that it's a spray onto the tongue or inside the cheeks. The Ministry of Health has a flow chart which talks about how other THC products are prescribed, and they need an application from a specialist. And this is a frustration I've had for the last 2 years with the Ministry of Health, where the Medical Council says that GPs like myself are specialists, but the Ministry of Health refuses to accept application forms from GPs. And it's quite problematic because a lot of pain doctors, rheumatologists, etc., are not interested in prescribing prescription cannabis. Many of them say there's not enough evidence. Well, my response is ask your patients. A lot of patients do respond really well. So I'm continuing to argue with the Ministry of Health that GPs like myself are in a very good position to safely prescribe something like Tilray 10-10, which is equal THC CBD. Here's an example of a patient, 64-year-old, chronic pain, mood disturbance, depressed because of the pain, nausea, recent video consult, smoking cannabis for relief of the emotional distress, but the quality varies. And the patient says, look, I don't want to get high. I just want relief from my symptoms. But the supply is variable in quality and availability, and so came to see me for prescription CBD, even though it is expensive. I'll just talk about a couple of other things. Palliative care, people can possess cannabis plant material and use it, and they may ask a doctor for a note confirming that they have an advanced progressive life-limiting condition. So this was because police were arresting and confiscating cannabis plant material from people who were dying. And we've got this transitional rule which allows them to possess what would otherwise be illegal. Of course, if someone's growing it for them, they're breaking the law growing it. You've heard a lot of arguments in favour of supporting a controlled legalisation where people can go to stores and know what they're buying. Compassionate cannabis, you may have heard of green fairies. These are people who are growing and supplying cannabis. They're breaking the law, they're risking prosecution themselves, but I'm calling it compassionate because they're doing it because they know that cannabis can benefit many people. Green Fairies are not from medical cannabis awareness, but this is a website as a patient support group, and the Ministry of Health has their own contact. With the referendum next month, with the election, we'll be asked, do you support the proposed cannabis legalisation and control bill? Yes, I support it, or no, I don't. And from the New Zealand Drug Foundation, if we say no, we like the current system where people buy from the black market and gangs are involved and there's no taxes and people don't know what they're getting, that's what a no vote implies. A yes vote means that we would like stores to set up restricted to 20 years of age, products clearly labelled, and police are spending $200 million a year at the moment on cannabis prosecutions. Surely that money could be spent better on addiction services, for instance. Maori are overrepresented in prosecution, which I think does them no good at all. Taxes to health education, including addiction. It's really saying that as health professionals, we think cannabis is a health issue rather than a legal issue. So in summary, at the moment, any doctor may prescribe CBD or Sativex to any patient for any condition. Products containing over 2% THC, apart from Sativex, are restricted to non-GP specialists. And in fact, GPs are specialists, so there's a mismatch there. The medicinal cannabis scheme is opening up to various products, but it's been very slow to allow a range of blends of THC and CBD, which I'm looking forward to. Patients need symptom relief now, and many can't afford prescription cannabis, so they are using illicit cannabis, and it would be a safer option for them if the cannabis was legalised and one day people were able to buy it at stores, know what they were buying, and the police would be able to get on with more serious issues. So that's really a harm reduction issue in terms of legalising at the referendum. I'm able to take questions if tech allows it. Ngā mihi nui, thank you for listening to this presentation.
Thanks very much, Graham. We do have some questions here for you. So from Chris, could CBD be prescribed for patients addicted to cannabis who want to stop taking it but find they have acute anxiety and addiction issues?
Right. I am an addiction specialist as well as a GP, and I'm pleased to say that I have been treating people with cannabis use disorder, also with stimulant dependence such as methamphetamine or P use, and alcohol dependence. So many addictions have associated underlying anxiety or depression or other emotional distress. And I think prescription cannabis can help deal with that, but it may also just make a bit of a safety net as they come down off their drugs of dependence, including cannabis.
Okay. And from Cheryl, she's saying that she recently had a friend look into cannabis for pain, and she said two things became apparent. One, that many GPs don't have the knowledge on how to use it, and two, it's very expensive. She's wondering if there will be more education for health prescribers and costs. Will the costs come down once the legislation changes, or if the legislation changes?
Well, I work as a specialist. I see patients self-referred or with a letter from a GP, and I write back to GPs, partly to educate the GP, partly because I want to hand over and encourage the GP to continue prescribing, which would be a cheaper option than continuing to see me. So that's educational and it's encouraging GPs to take this up. I'm giving webinars such as this to GPs as well. In terms of cost, we're hoping that New Zealand grown cannabis will be cheaper in the long run. About 20 companies are licensed to grow, and they're developing products, and these will need to be assessed. And we're hoping that because it doesn't need to be imported, that will get the price down. However, a lot of people are still going to go the recreational or adult use pathway, which is illegal cannabis at the moment, or if the law is changed to allow legalization and control where stores will be able to sell cannabis, then in future we may be able to see perhaps a cheaper availability of cannabis through such stores rather than on prescription. But people will want to come to doctors as well. Children with seizures, for instance, we certainly wouldn't recommend plant cannabis because it's really important to know the strength and constituents.
Well, thank you, Graham. I've got lots of thanks here. A lot of people saying it was been a great presentation. I was just going to pick up on your comment about the seizures and everything. So, is the CBD products indicated in some forms of epilepsy?
One of the things that I do with anyone on any prescription, whether it's for anti-seizure medication or pain relief or antidepressants, I say, carry on with your standard prescription and add the prescription cannabis. Once we know if it's working, then maybe you can start reducing your other medicines. And certainly with seizures, I'll see people who are on 1 or 2 or 3 anti-seizure medicines, and it's really important to not destabilise. Now, the medicines may or may not be working, but really important to continue those, add prescription cannabis, try and find some stability, and then consider very cautiously, slowly reducing if that's what the person wants. Of course, I'll see some people on anti-epileptic drugs with poor control add the CBD, and they may find that they get better control, and some of them will continue with standard plus prescription cannabis as a combo.
Okay. Another one from Moana, and you may not know the answer to this one, and if not, then I'll look it up. Do you know anything about the implications for nurses using prescription cannabis and how that affects nursing practice overall?
One of the good things about CBD is that it's non-impairing. I do ask people to be cautious. A small proportion may be sedated on it, and as a doctor, if I'm prescribing benzos or opioids or even antidepressants, we need to caution people about the possibility of sedation or some impairment. So cannabis is the same. However, CBD, I think, carries a very low chance of sedation or any other impairment. So I think that's fine. I have seen nurses who have started Sativex for chronic pain, lifted that heavy patient and the back never got better. So Sativex then will have equal THC and CBD. It's a prescription medicine, and I think that a covering letter if required. But again, watch out for impairment. That's really the test. As health professionals, we can't go to work impaired, so people need to check for that, and if they need a letter to say yes, they're on medicine containing THC, particularly those who might be subject to urine drug testing, then a letter should cover that.
Okay. And one from Lynn here asking if CBD is useful for chronic leg spasms or muscle spasm in general.
Yeah, it can be, and restless leg syndrome as well. We've had some good results. But look, one of the ironies is that to make a bottle of CBD means that usually you start with a plant that contains THC and CBD, It costs money to take the THC out to make pure CBD, and this is what our Ministry of Health has required under the regulations, is pretty much pure CBD. So it's more expensive because the THC is taken out, but if a little bit of THC is in, it actually works better with very low risk of impairment, and so the combination of THC and CBD is a better one for the patient. But at the moment, we've pretty much got just the CBD.
Well, thank you very much, Graham. We come to the end of the questions there, and I've appreciated this a lot, and clearly by all the responses a lot of other nurses here have. So, and thank you very much for that.